Hi, my name is Wendy Steffes. We're going to be doing an assessment, a HEENT assessment, head, ears, eyes, nose, and throat assessment on my daughter Morgan. So first what I'm going to do is just take a look at your head here, just looking for the size and the shape and the configuration. I'm going to look at your face, just make sure that it's symmetrical, nice and round, all the features and your movements are coordinated. I'm going to look at your neck, or just kind of feel your neck here, and also take a look at it to make sure there's perfect shape here and any presence of any kind of lumps or masses. I'm going to feel that. I'm just going to check your thyroid here and your cricoid. Just palpate with my fingers here. Try not to laugh, Morgan, I'm sorry. I'm gonna feel your vertebrae, so I'm just gonna gently move down your neck here with my fingers. And then I'm just going to have you do a range of motion with your head, so if you can look side to side, and then this way, just to make sure that your range of motion is symmetrical and there's no problems there. Okay, I'm just gonna put some gloves on here because I'm gonna be palpating your head and kind of going through all the different systems here. So I'm just going to look at your head for consistency and just palpate to make sure there's no masses. Okay, I'm going to check your temporal arteries here. All right. There's no tenderness, right? No tenderness, Morgan? Okay. And then I'm going to check for TMJ. So if you can just open and close your jaw like this. Good, okay. So there's no popping or locking when I do that. And if you'll just lift your chin, I'm just going to check your trachea. Just move down it to make sure there's no lumps or bumps, masses. Okay. I'm going to check your thyroid, so I'm actually going to move behind you. And so hopefully you'll be able to see this, but go ahead and have a seat. And then I'm going to check your thyroid to make sure that there is no lumps or masses there. And then if you will just swallow for me. Okay, perfect. Next, I'm going to check, let's get back, thank you. I'm going to check your thyroid gland, or your lymph nodes. So I'm going to check your periauricular, which are in front of the ear canal, and your post-auricular behind your ears, okay? Your occipitals, which are below your ear here, don't fall asleep here. Your tonsillar, which you don't have any tonsils, but you should have lymph nodes next to them. Your submandibular, which is underneath. And then your anterior cervicular nodes and your posterior cervicular nodes. And then your supraclavicular, which is above your clavicle. Okay. I'm going to auscultate your thyroid here. All right, and if you will just hold your breath for me. Okay, that sounds well. All right, now we're going to do a vision test. So I am going to have you look at these letters and read these letters off to me from top to bottom. What is the lowest that you can see? So just go ahead and start from top and go down to the bottom.
E, F, P,
Okay.
T, O, Z, L, F, E, D, M, N, O, P.
Okay, perfect. So you can see that just fine. All right, I'm going to check your visual field. So I just want you to, whoops. I'm going to take this and I'm going to have you just follow it with your eyes. Okay. And then once again on the other side. Okay. Perfect. And then I'm going to move towards you. Just looking at your eyes and out. Okay, perfect. Okay, I am going to use a flashlight. I'm going to shine it into your eyes, okay?
Cool.
Actually, I'm going to do the, I'll do the light test now. So I'm just going to shine this into your eyes. So just go ahead and open your eyes here.
Oh.
Sorry, I know it's quite bright. Let me come from the side here. I just want to make sure that your pupils dilate. Hopefully it won't water. Okay. They're working perfectly. We'll do this again on this side. Wonderful. And then if you'll just open your eyes wide. I'm sorry, this light is so bright. I wish that I had a ophthalmoscope, but I don't. Okay, perfect. All right, and just check, and I checked for corneal reflex, corneal light reflex. We're gonna do the cover test. So what I want you to do, this is testing for your eye alignment and strength. So I'm just gonna pull this next to you and pull it aside, okay? I'm gonna do this on this side as well. Wonderful, okay? Let's see here. Oh, I'm gonna do the positions test. So I'm just gonna use this, and this is to test for eye muscle and strength. So I'm just going to do this, move it around. Okay, perfect. Okay, wonderful. I'm trying to think if I'm gonna check your peripheral vision. So I'm going to move my fingers from the back of your head to the front, and then just let me know when they come into your side of vision.
Right now.
Right now? Okay, wonderful. Okay, so next I'm just gonna do a general inspection of your eyes. Look at your eyes here, look at your eyelids, look at your eyelashes, the positioning of your eyes, okay? I'm gonna look at your bulbular conjunctiva, and I'm gonna look above, and then I'm gonna pull down on your eyelids. Wonderful. And that is your palpebral conjunctiva. I'm gonna look inside your lacrimal apparatus here, and then just look at your cornea and your lens here as well. If I did have an ophthalmoscope, then I would be looking for your red reflex. So I'm just gonna kind of pretend like I'm looking for your red reflex. I don't have one, so I would be looking for that, and I can see that just fine. Okay, and then I'm just gonna palpate here just to make sure there's no masses. This is your lacrimal apparatus there, okay? Next, I'm gonna check your ears, all right? So I'm just gonna inspect the ear itself and look at everything to make sure that it's shaped perfectly, that there's no masses, no problems here, that there's no tenderness at all when I do that on both sides. And I'm just doing a general inspection here of her ear. I'm looking at the auricle, at the tragus, and also at the lobule. If I had my little otoscope, I would look into your ear, and so I'm just going to pretend like I'm looking into your ear to look at your tympanic membrane to make sure that there is no signs of infection and that everything looks good on that. With an adult, you're going to lift up on the ear and back, okay? I'll do that again on this side since I didn't do it properly. Lift up and back, okay? And everything looks good there. I'm just gonna check to see if we have any tenderness here. Is there any tenderness, Morgan? No? Okay, perfect. All right, now I'm gonna check for your hearing acuity. So I'm gonna do a whisper test. So I'm just gonna close your ear here, and I'm going to say a 2-syllable word, and just let me know if you hear that, okay? Apple.
Do I have to say back? Yeah. Apple.
Okay. And then do on this side, baseball.
Baseball.
Okay, perfect. All right, I'm going to check the Weber test, and by doing this, I'm going to just kind of bang my little tuning fork here and stick it right here in the middle of your forehead, and I want to know if you hear it in which ear, okay? Hold on, whoops. Which ear do you hear it in?
I don't hear it in the ear.
Okay, let's try that again. Do you hear it in either ear? Okay, she's deaf. All right, no, I'm just kidding. All right, okay, let's try the brine test, okay? So I'm going to do this again, and then I'm going to put it behind here, all right? And then put it in front of your ear. So I just need to know if you tell me when you stop feeling that. Okay. Oh. Tell me when you stop hearing that. Can you still hear it?
Okay, it stopped.
Okay, I'm going to do it on the other ear. Whoops. Oh, shoot, sorry. Tell me when you stop feeling it.
It stopped.
Okay. When you stop hearing it.
It stopped.
Okay. All right, now we're going to check for equilibrium. So I'll need you to stand up, Morgan. And just kind of slide that to the side, okay? And then stand tall, put your feet next to each other, all right? Put your arms to the side, actually not to the side right here, all right? And then open your eyes, keep your eyes open, and then close your eyes. Okay, do you feel like you balanced well? Okay, not dizzy at all? No? Okay, perfect. All right, have a seat. Now we're gonna check for your mouth, okay? So I just want you to open your mouth here. And then basically I'm going to look inside her mouth, but I'm going to notice if I identify any distinct odors whatsoever. Okay, make sure that you don't have gingivitis and that you're brushing and flossing properly. Now I'm just going to inspect the inside of your mouth. All right, so I'm going to be looking at your teeth and your gums and also your mucosa, okay? I'm just gonna use one hand so that I don't, I stay clean on that, all right? And stick your tongue out for me, all right? And say, ah. And I'm just gonna check her uvula. She does not have tonsils, so I won't be checking for her tonsils at all. But everything is normal color, nice and pink and moist, and no tonsils. Now I'm going to pretend that this is an otoscope again, and I'm going to check your nose. So as if this was a light, I'm going to look up into your nose. So just lift your chin here, and then I'm going to check inside your nose to make sure that yes, everything looks good and pink and moist as well. I'm going to palpate your gums, make sure there's no masses, and then also look inside your mouth again. And if my gloves are clean, and just check for any masses inside your mouth. Oh, sorry, up and around and on the sides of your gum here, okay? Next, I'm just gonna check for any sinus tenderness, okay? So any tenderness at all up here in your sinuses? No? Okay, perfect. Well, it looks like you're a healthy 21-year-old female. So that concludes our assessment today. Thank you very much.